Hello and welcome everyone. My name is Liz and I'm going to be facilitating today's Niagara Connects webinar. With us today we have Ahmed and Jillien from the Niagara Folk Arts Multicultural Center. The Niagara Folk Arts Multicultural Center is a charitable, not-for-profit organization incorporated as the Folk Arts Council of St. Catharines in 1970, so a very rich history, having a mandate to support and assist the ethnocultural and newcomer community in Niagara through a broad range of programs and services. So Ahmed is a mental health program support worker, and Jillien a volunteer coordinator with the Niagara Folk Arts Multicultural Center. Today, Ali and Jillien will be sharing their work related to breaking barriers to newcomer mental health in Niagara, so very timely and important content to share. Niagara Connects is very pleased to offer this opportunity for Ali and Jillien to share their work today and for the community to connect directly with you folks. So for our participants joining, and if you're new to webinars, today's session will begin with the presentation, which will be approximately 40 minutes, and it will be followed by a facilitated question and answer period, approximately 20 minutes. You can share your questions at any point in time. Down in the Q&A on the left hand, you can type in your questions, and my counterpart, Sarah, who's on the line as well from Niagara Connects, when we get to the Q&A period, she's going to flag those questions. I'm going to read them aloud. And then at that time, should you wish to engage with the presenter, you can take yourself off of mute. I'll remind everyone of the codes at that time, and then put yourself back on mute again just to manage the noise. So if anyone has any questions or comments before we get going, feel free to type it into the chat pod. We're okay for sound. So on that note, I am going to hand things over to our presenters, Ali and Jillien. Take it away, folks.
Hello, everyone. Just wanted to wish you a happy Wednesday, and I hope you guys are doing well. So my name is Ahmed, and I am the mental health support worker at the Niagara Folk Arts Multicultural Center.
And my name is Jillien, and I'm the volunteer coordinator here at the Niagara Folk Arts Multicultural Center. So before Ali and I begin our presentation today, we just wanted to send out our most sincere thanks to Niagara Connects for hosting us today, as well as to our facilitators, Liz and Sarah, who are helping us out so much with all the tech support on the back end today. So thank you so much to everyone at Niagara Connects. We also want to thank everyone who is joining us today in the audience. We're hoping that we can not only provide you with some new information based on our pilot project that dealt with newcomers and mental health, but also maybe we can start a larger conversation about finding some solutions when we're working with newcomers and issues around mental health. So we're calling our presentation today Bridging Barriers to Newcomer Mental Health. So we would like to not only discuss the barriers there are to newcomers accessing mental health services in the Niagara region, but we also, like I said, we also want to talk about how we're actually going to bridge those barriers using the data that we collected through our pilot project. So again, welcome everyone, and thank you so much for joining us. Okay, so on this second slide here, Ali has so kindly incorporated some photos of ourselves. So we just wanted to reiterate that the Niagara Folk Arts Multicultural Center, we have deep connections with the people that we work with. So we felt it was important to present some photos of ourselves in the sense that we hope we'll connect more deeply if you have a little bit of an idea of what we look like. So there we are there, Ali and I, very big smiles. So the overview of the webinar today, Ali and I are going to start with some background information. Then we're going to move on to talk about our environmental scan. Then we're going to present you with the actual data that we collected from our pilot project. We are going to discuss some next steps and also recommendations that we have for bridging these barriers to newcomer mental health. And then, as Liz spoke about earlier, we're going to offer a Q&A period to you folks to engage with Ali and myself about newcomer mental health.
All right, guys. So just a little bit of background information. We got provincially funded for a one-year pilot program. So before at our center, a couple of colleagues applied for a grant. When looking at our center, we provide services for the newcomer population, and some of them come from war-torn countries. Some of them have career planning or communication skills issues, and we saw that they have a lot of main concerns, and it was so we thought applying for the grant and looking into it, that would be a good opportunity for our center to help the newcomers that come in and provide them with the services necessary. So our purpose was to provide initial mental health support for newcomers in Niagara region that experience language and other social barriers in accessing services. Our aim was to bridge the cultural gaps that currently exist in our health services, and within the region provide a gateway for clients to access long-term or medical mental health attention if needed. We did this by compiling data, getting testimonials from clients to see whether or not their mental health status was improving and see how easily that they could integrate into the society. So the findings that we accumulated with our final, we talked to funders as well as other mental health services to make it more inclusive for newcomer mental health. These findings are not just for our program, but we want to share with other community organizations to increase partnerships and collaborations in order to improve service provision. And looking at it, we also, before the program started, we want to look at some challenges that we may have. We have reports of extremely low rates of mental health service utilization and access by newcomer population, and that will be shown in the next slide. But we also want to look at contextual or cultural factors that may affect mental health for newcomers. A lot of times when newcomers are back home, there's a lot of stigma where people that have mental health, those are the crazy ones, and they don't want to be associated with them. They might present with physical symptoms instead of psychological symptoms. Even though that the main issue might be mental health, they don't want to address it as that just because of the stigma associated with it. Also, clients may not be able to speak any English or very little, which can make it hard to communicate with a translator. We also have to be aware that clients have kids. Is daycare provided, or do they have to stay home because they're not able to attend the mental health meeting? We have to be aware of abuse. If it's women, men can't be in the room for maybe one-on-one counseling sessions. And we also want to look at other cultural factors, include missed time off work, people not showing up for meetings, long waiting times, some families overseas, court dates, and looking at the client's body language as well. So our plan and execution of this program was to have an evaluation plan where we could identify needs, systematic gaps, and barriers in order to outline the requirements for best practice in order to treat newcomers.
Okay, thanks so much, Ali. So I'm going to give you a bit of a broader lens, and we're going to actually talk about some of the gaps in the Niagara region that called for the beginnings of this pilot project. So the Living in Niagara reports, the 27 reports, as I'm sure many of you are familiar with, actually reported that there were 67,000 newcomers arriving in Niagara between the years 2011 and 2016. Yet our mental health coordinator, she had set up a meeting with the Canadian Mental Health Association, their program manager here in Niagara, Sarah Beaton, and she actually had a conversation with her in 2018 in the summertime, and there were only 12 documented newcomer clients in the Canadian Mental Health Association's system. So knowing, coming from a mental health background, we know as Canadians that there's actually reports of 1 in 5 of us experiencing a mental health illness or problem in any given year. Yet, this represents there were only 12 documented people in the Niagara region in 2018 who are using the CMHA services. This means that there were extremely low rates of mental health service utilization and access by our newcomers. So here we go. We're presenting this kind of major gap in our region in terms of mental health services and the intersection of the very specific newcomer population.
So some information about our pilot program. It's a mental health focused program that provides counseling and educational mental health services to newcomers at the Niagara Folk Arts Multicultural Center. What we wanted to do is that we didn't want to just focus on one thing. We wanted to focus on all aspects. So we wanted to have emphasis on research, private counseling, educational programs, and social support activities. We wanted to take a holistic approach, and that's not to say that having one of them might not help, because having maybe just counseling could help the client, but we wanted to make the client feel comfortable, to be educated, to feel support in doing activities, and therefore increase the wellness. So we thought it was important to include all of these programs into our program. So for emphasis on research, before we even started the pilot program, we looked at best evidence-based practice in Canada and in other countries as well, and we wanted to see how we can implement them into our program. From there, we found that we should have a good balance of counseling, education, and social support activities that we wanted to address. We also constantly look at our data while we were doing the pilot program to notify any trends or differences and how we can go about addressing those gaps and make the immediate changes that are necessary. For private counseling, it was one-on-one counseling for our clients, and we had educational and mental health services to newcomers within the Niagara region. Just give me one moment, folks. Sorry about the delay. Okay. So as I was saying before, we have one-on-one counseling activities for our clients, and we had 3 different types of counselors. So 2 of them were Mandarin-speaking counselors, and one of them being Spanish-speaking counselors as well. We found that this was important because the main languages at our center were Spanish, Mandarin, and Arabic. And we also had Arabic translators as well in our settlement department and our community connections department. And they were able to help with that as well. And being able to have translators that are able to speak the first language makes the client feel comfortable and at ease, and makes them more likely to share information. So we thought that was important. And some of the things that were discussed on one-on-one counseling involve things such as main concerns. Main thing is that we wanted to listen to the story. I think a lot of times that clients or newcomers, they just want to be heard. They want to know that people are listening and that people are paying attention to them. So we also provided referrals for them. We looked at things such as, again, main concerns, PHQ-9 and GAD-7, which were depression scales and anxiety scales. And this it wasn't for a diagnosis for any depression or anxiety, but it serves as a baseline to whether or not the client was improving or getting worse over time. And then we wanted to educate clients as well. So we did a lot of anti-stigma presentations, and these were educational sessions that we ran and presented to different ESL groups across the region. These included our 120 students at the Niagara Folk Arts Center. We also did it at Fort Erie, Welland, and we also ventured out to high school groups in St. Catharines, such as Dennis Morris, Holy Cross, Sir Winston, and West Lane that had high newcomer population. because we didn't just want to address the adult population. We want to take the time and talk to the youth as well, because a lot of these stigmas, they're presented at an early age and they carry on throughout. So by doing maybe like a primary prevention, try to attack it from early, this can help folks. And what we found is that most of these sessions were presented in first language, depending on the group with whom we spoke. We also took translators when possible for other languages not covered by our staff. And within these sessions, we talked about different topics such as stigma, resilience, misconceptions about mental health, and cultural perspectives on mental health, and more. And this helped with our internal referrals for one-on-one counseling and group activities as well. Our internal referrals involve like settlement and other staff, but the clients after the presentations we were seeing that they were more likely to come forward and present maybe certain concerns or be involved in different activities. And we also had social support activities to build therapeutic and social relationships. And that involved things like Women's Trust Circle, which was conversation about communication skills with partners and children, love languages, coping with stress. We had Men's Conversation Circle, and that was a big one, where men oftentimes don't want to talk about their problems or their concerns. But we created a safe space where they could talk about things back home or things that were bothering them. And we did it through activities and talking. So we felt that was important. We also had art therapy. We had a ping pong club. We had yoga. We had Tai Chi. So we had many things that we tried to incorporate here at the center to make sure the clients have the best experience possible. And for the environmental scan, we asked we got responses from 22 organizations from about 5 specific questions we asked. And this gave us an idea of where we can refer clients to for mental health reasons. It allowed us to gauge certain barriers or needs that are needed in the Niagara community. It allowed us as an organization to assess our strengths, weaknesses, and be aware of opportunities to collaborate with different organizations in order to ensure the needs are being met.
Okay, thanks so much, Ali. So in terms of what we gathered from this environmental scan, as you can see on your slides here, there's a list of 8 organizations that actually identified, and they make up that dark blue 36% on the pie chart on your left-hand side. Those organizations self-reported to our staff that they frequently see newcomer clients and that they frequently access their mental health services. So this is a bit of gives you a little bit of knowledge as to what is actually happening in the Niagara region in terms of access by the newcomer populations. So again, this means that the other 64% of the organizations, of the 22 participating organizations, either rarely or do not actually see newcomers accessing their mental health services. So this is gives you a little bit of an idea, like I said, of the environment that this pilot project was developed within.
So we asked in the questionnaire if there were specific needs in order to best serve newcomers. And we found that these were the 4 main responses that we got from organizations. The number 1 response we got is that we found 7 organizations have a need for multilingual staff and multilingual programs, followed by we found out 4 organizations wanted resources specific to the newcomer population, and then we had identified need for training staff as well as improved cultural sensitivity training. So this gives us an idea, this slide, on what is needed in certain organizations in the Niagara region in order to best deal with the newcomer population. It tells us where the gap lies in the Niagara region, and it can serve as a discussion point in order to find ways to address this issue. And I think this is a good first step by having the knowledge on what are the specific needs in the community. because when having the knowledge, this can affect the attitudes and changes that we need, and hopefully this will lead to behavioral changes within the leaders in our organizations and trickle down to staff, so all the newcomer population can succeed.
Great, thanks so much, Ali. So this next slide represents when we were doing our environmental scan, we actually asked Niagara-based agencies what they identified as the major barriers being to newcomers accessing their mental health services. So in response, we found language barriers, followed by funding to be the two largest barriers to that access. So language, we figure absolutely has to do with translation services, or as Ali spoke about earlier, the importance of actually having counselors communicating in that first language of our clients, and organizations not having the funding or the ability to actually engage those kinds of multilingual staff in their programming. So again, as you can see here, other barriers that were identified included housing, limited social groups, translation services, accessibility, and fear. And fear, that last barrier as being a reason why newcomers maybe are not accessing mental health services, plays a big part into, stigma plays a big part into this fear element, this fear barrier. Which leads us actually to our next slide as well. So as part of our mental health pilot project, we actually worked out an Anti-Stigma Campaign, which, as Ali mentioned, focused on educational workshops for newcomer clients, especially ESL students, as well as newcomer students that we came across in various local high schools. So the idea behind the campaign was to not only bring about a larger conversation about the knowledge and misconceptions that we have about mental health, but also to start that conversation about our attitudes, whether culturally derived or not, about what it means to have or not have mental health, in the hopes, as Ali mentioned earlier, to lead to some changes in our community culture here around mental health, but also within our specific to our newcomer populations. So we felt as though we started to break down some of the barriers that we're talking about through this campaign, because we had newcomers actively engaged in conversations within the community about something like mental health. So again, Ali will present the results in the next slide here, so I'll turn it back over to him.
So when looking at our pilot program, we've had a total of 392 clients that we served, and this included one-on-one sessions as well as group sessions. As you can see on the slide, the majority of our clients are female, with 68%, and the other 32% of our clients were male. The amount of clients we served on one-on-one sessions were 131 clients, and 76 of those individuals met only once with the counselor, while 55 of the clients have met with the counselor 2 or more times. So our lowest range from 1, and some clients met with the counselors like 15 or more times. So it varied. And we also had people doing group activities. So 196 individuals only did group activities 1 time, and we had 118 individuals doing group activities 2 or more times. There is some overlap in the data, just because people that attended one-on-one sessions with the counselor also attended group activities as well. And the group activities included, as mentioned before, Women's Trust Circle, Men's Conversation, English Cafe, and Art Therapy, to name a few. And the total number of visits we had in group activities and one-on-one sessions were a total of 833, with 68% of the data being from groups and 32% of the data being from the individuals. So when looking at the demographics for immigration status for our mental health program, we served a variety of clients regarding their status, with the most prevalent being refugee claimants and permanent residents. We've also had citizens, student permits, convention refugees, visitors, work permit, and intent to land as well too. And when looking at the percentage of clients' age groups, we serve clients as young as 5 years old with parent supervision, and we serve clients as old as 85 years old. So there was a wide range for our age group. And the largest population were adults aged 30 to 50, making up 37% of the data. We also had a good amount of youth clients from age 10 to 30, which make up 24% of the data. The unknown category means that data was not included in our apricot system, which is something we use at the center to keep track of vital information for the client. So we keep things like age, client, when the client came to Canada, first language, their status in Canada. So potential reasons why they were not included could be clients brought friends, or some cities that we went to do not use the apricot system, or had issues providing personal information due to refusal or confidentiality. And as a result, we were unable to retrieve this information. This only truly applies to clients who attended activities and not one-on-one counseling. So for one-on-one counseling, we had all the data provided as immigration status and their age groups, and there was no unknown variables. But for group activities, some clients brought friends and stuff, so it was hard to gauge.
Excuse me. So for the next slide here, we're actually hoping that you will all participate. So we've set up, with the help of the Niagara Connects team, a little bit of a poll before we actually present the data that we found around our clients' main concerns and challenges that they were seeking support for when they were accessing our services. Sorry about that phone, folks. So are we good to go to the next slide, Liz, or?
Yeah, we're going to move to the next slide. Just before we proceed, the poll itself only has the acronym. So we just wanted to post up here that CP stands for Career Planning, CS,
yes, thank you so much,
Communication Skills, EI, Emotional Issues, and FIHC, for Families in Home Countries. The characters were too long for us to put them as full response options for the poll, so we thought that prudent to highlight what those are. Sarah, did you want to pull the poll up?
Thanks so much. Thanks, Sarah.
Great. So folks can
Perfect.
Enter their answers, and we'll see the results here.
Okay. We've got responses coming in. Awesome. Thank you, everyone.
Live polls are always fun.
Okay. There you go, Ali. A little more data for you.
Perfect.
Just what you need, right? So
Absolutely.
Most people use that communication skills. Yeah, never enough data. We all know that. Communication skills, 40%. Amazing. Okay. Take note of that, Ali. Awesome.
For sure.
Going to continue then there, Sarah. Awesome. Thank you so much. Okay, so our next slide, we're actually going to present you with the results that we found. Thank you for contributing, though. So during our one-on-one counseling sessions, one of the things that we were very, very interested in finding out about is what are the main concerns that newcomers have in terms of their mental health. So this pie chart actually represents the findings found in those one-on-one sessions. So again, we want to say that, of course, there were many concerns that newcomers had around their mental health, but this chart is specific to their number one concern. Okay, folks? So, so when we collected our data, we actually found out that emotional issues, so represented at 22% in kind of a medium blue on the right upper hand of the pie chart, that is emotional issues. So that was the number one main concern found within our data. And this concern is a sense of kind of sadness and overwhelming feelings over a long period of time. The second highest main concern for our population that we found through our data was actually career planning. So if you can see on the top left hand of the pie chart in kind of a lighter blue color, we're looking at 15% of polled newcomers found that career planning was actually causing them a great deal of concern. So again, I think Ali spoke a little bit about this earlier. When newcomers come to Canada, often their education, their degrees, they don't often translate, at least directly, into the Canadian context. So we find that this is a very, very high concern, high stress situation for a lot of our newcomers. So that just gives you a little bit of an idea of some of the main concerns that we were presented with in our mental health project.
All right. So we also wanted to look at main concerns by immigration status. So we wanted to see are some immigration statuses more prone to main concerns than others. And when looking at our data, we found that refugee claimants struggle most with emotional issues and stress management, which can be seen by the large orange bar and the yellow bar beside it. And then we found that permanent residents struggle with career planning. So as Jillien mentioned, degrees don't often translate here. They're learning a new language, so they have to get proficient in English first and then do schooling. So there's a lot of variables that come into play. And another thing we found is that convention refugees, the leading causes were stress management and emotional issues. So this kind of gives us an idea by different categories on what certain immigration statuses feel, and it is separated. So refugee claimants and permanent residents and convention refugees, they all have like different needs and to be met, and we should just not paint with like a broad picture kind of thing. And just 5 key learning things and success factors that we learned from doing our program is that it's important to have service in first language. So even doing the anti-stigma presentations, make sure that we have Arabic-speaking staff, Spanish, Mandarin, sometimes even French. And we try to have all different staff that can speak the language and interpret to the clients. As well, this helps with one-on-one counseling so things don't get lost in translation, which was mentioned before. It's also important to have continuous anti-stigma workshops, and this can increase immigrant mental health service requests, because even when we did the campaigns, we had a lot of internal referrals, as mentioned before, because people felt comfortable with us and able to talk about certain topics. At our center, we have childcare, we have daycare, and we provide transportation, so we felt that this really helped. So having on-site childcare can make the client feel less stressed that someone's caring for their children while they're addressing their mental health issues, and that they don't have to stay at home with their children. Also provided culturally informed social support activities. So things like having a social purpose, volunteering, arts and craft-based physical activities led to more internal referrals, and community space versus institutional space. So we had like supportive physical and social environment with our settlement agency and support from peers. So I guess the good thing about being a non-for-profit organization that welcomes newcomers, we have many departments that help. We have settlement, we have job search, we have daycare, we have mentorship, we have youth program. So all of these come together. Like the clients, they feel comfortable that they're able to talk with us. If they have issues, then they don't feel like they have to like necessarily go to like a doctor right away where there might be a language barrier. The feeling like, I wouldn't say like home, but feeling comfortable in your environment and your surroundings allows like the newcomer clients to be able to participate in activities, to participate in one-on-one counseling, because there's no like judging from us, and we're kind of like a team where like one person suffers, we all suffer, and then if we succeed, we all do. So I think that's important to have an environment like that, and I think that is something that helped us out.
Okay, thanks, Ali. So based on these key learnings, what we're proposing moving forward in the Niagara region, but also beyond the Niagara region, is exactly what we work for here at the Multicultural Center, and that is to create safe and inclusive communities for our newcomers. So we're hoping that our program will have 3 main components. Most of these components were built into our pilot project, and with those emerging best practices that we found, we're hoping to move forward with these 3 components as well. So the first component being working to increase connection to supports. So again, those social support programs and activities that Ali was speaking so highly of, continuing with those programs in this community, as we could see many of the benefits in our everyday work in this environment. The second component being increasing the engagement of our neighbors and our community members in this kind of work. So again, when we are in the ESL classes and the various high schools, inviting even more folks into the conversation about mental health in a culturally safe and sensitive way. This is one of the most important components of our project moving forward. And again, the third piece, overall increasing the well-being and the safety of our newcomer population here in the Niagara region. So continuing with one-on-one and group counseling supports that is geared towards their very specific needs, and that absolutely is informed with a cultural lens.
So recommendation the center has is that we wanted to support approaches to promoting migrant well-being across systems, including health, social services, settlement, education, through developing, enhancing, and coordinating partnerships between sectors. We want to support integrated community-based mental health services that look at social determinants of migrant mental health, look at gender and life stage sensitivity, recognize both challenges and resiliency of diverse groups of migrants. We also wanted to have the appropriate education and training. So providing public education campaigns that are directed at a diverse groups of migrants on the mental health system, which could be acute and community-based services and how to access them appropriately, and provide education to health and social service providers, as well as students on culturally competent mental health promotion. We also want to support policies that remove barriers to economic and social integration of newcomers. So, for example, through training and education. And the last point is that we want to recommend support longitudinal and comparative research of migrant mental health that considers multiple determinants of well-being through interdisciplinary approaches and community academia alliances.
Wonderful.
And
Liz here again. Ali and Jillien, thank you so much. Ali, did you have anything else you wanted to add in?
No, I just wanted to say thank you guys for tuning in.
Excellent.
Thank you so much, everyone.
Yeah.
Excellent. Thank you guys so much for your presentation, for sharing your work, unpacking for us some of the barriers to accessing mental health services for the newcomer community, and sharing your holistic approach to your evidence-based pilot, including some of the findings from your environmental scan, emphasizing the research, the private counseling, the educational programming and social support activities, highlighting the need for people to feel heard, and including youth to take a preventative approach, offering so many social supports and different therapeutic activities, for drawing out the community needs for the Niagara region specifically, hearing language and funding, for example, as key, as well as fear, and that stigma plays a key role in this part, for sharing your Anti-Stigma Campaign, and then, of course, your findings, highlighting the diversity of experiences within the newcomer community, for us to not paint the community with one brush. Your 5 key learnings being that service be provided in first language, anti-stigma campaigns being key, support such as childcare and transportation being very important, culturally informed social support activities, and community versus institutional space. So these being your emerging best practices, and of course your recommendations for the Niagara community. So we really, really appreciate that. I'm sure folks have come today to hear about emerging best practices. And we have this time now, folks, for you to share your questions in the chat pod here. And I'm going to move through them. And again, if you'd like to speak with the presenters, don't be shy. You can press your line *7 to unmute. Should you wish to engage with the presenters here, no pressure otherwise. My job to facilitate the dialogue today, so I'm happy to do so. I'm going to get going with, we've got 3 questions, so I encourage folks, we've got 20 minutes, so please do also add questions here. We've got Teresa and Zovino, apologies if I mispronounced. How do you define newcomer? For example, did you include international students?
Did we include, yeah, international students were included in our data as well too. We did presentations in high schools and Brock universities, and actually a lot of the population were international students that we presented in front of. So.
Wonderful. And did you find different form of engagement with that group relative to other? You mentioned about the kind of plurality and diversity in across the newcomer community.
I don't know exactly because I wasn't part of the presentations for the international students, but that is something I can get back to you.
Okay, so on that note, Teresa mentioned she wondered how she could connect with you to look at strengthening partnership between Niagara College mental health programs and our large international student population.
Yeah, you can connect through the folk arts. Our mental health coordinator named Zanab. I guess I can just write her email here. I don't know, but it's zawad@folk-arts.ca, and we can probably try to set up a collaboration there. I think we do some stuff with Niagara College already. I know before every Friday we had our settlement department go there and talk with international students and regarding their immigration status and help them out there as well. But we are always open to opportunities and looking forward to it.
Excellent. A great opportunity to make an active connection on the line, and that's something we could also include in the follow-up materials if folks are interested. Mm-hmm. We've got another question here from Nazumo Ozaki. What is the difference between conventional refugees and refugee claimants?
So refugee claimants are when the refugees first come into the country claiming like asylum, and then convention refugees, like I believe when they're waiting for like their court date to be processed, and then they actually apply for the refugee status in court, I believe.
Excellent. So just friendly reminder, if folks have any follow-on questions, once your question's been read aloud, you can *7 to unmute. No pressure, though. We're going to keep on going. We've got a few more questions here, so great. Thank you guys for contributing. We have Mary Wiley, our Executive Director for Niagara Connects, who has shared very well-presented information. Do you know of any comparative work done in other communities in Ontario or beyond?
I don't know, to be honest. I think that's something our mental health program coordinator would be able to elaborate more on. But I think when we were looking at best practices, we did take some from practices in Canada and different places in Ontario, and we found certain things that worked with like programs, like having like social support activities and anti-stigma workshops. But I don't know the answer to it. I'm sure there are, but I'm not sure.
Ollie, did you guys publish your environmental scan or share that with folks? Or is that something that would be maybe highlighted with them?
I know we had a mental health symposium and we did present the data, but we can definitely share our environmental scan and our mental health data with all the people here because it's now updated because our program ended at the end of March. So now we have all the data accumulated. So I think that is something that we will do is send it to the people that attended the symposium and also the people that attended the webinar right now.
Wonderful. So Mary has a quick follow-on as well. To what extent do newcomers have to go outside Niagara to access language or culturally appropriate mental health services?
I'm not. To what extent do you have to go outside?
Like, do you actively refer outside if there's, for example, maybe first language appropriate or culturally appropriate service that isn't available in the Niagara region?
Usually travel is an issue, at least with our population. We find that it's hard for them to travel for. Like some of them, like we were trying to look for like a psychologist like in a certain language, but like the farthest was like, I believe like in the Toronto area, and then it's hard to send them all the way out there. Like how are they gonna get back? Because what we do provide bus tickets and childcare, but it's hard for them to access outside the Niagara region. And even when they do go to the Niagara region itself, it's sometimes they're hesitant to ask because even go to the appointments because of the stigma, or they don't really know like the people. Do they speak the first language? And there's like a lot of barriers. So sometimes like maybe like having even people come here to the center may make it more comfortable, like for the newcomer population. But it all depends,
Okay. So we've got...
Actually, could I add to that? Sorry, Liz.
Absolutely. Go ahead.
The other thing I would add to that, Mary, like just to give an example, I had actually been working with a newcomer who had high level of, actually she did counseling for victims of domestic abuse and violence. And she actually had to seek out, she had to actually drain her skills from Niagara to travel to Toronto to be active in her field. So just as an example of perhaps our program, we could actually keep our very skilled newcomers in our area doing the work that they want to be doing and are skilled and very capable of doing if we were able to continue with our program. So just a small example to add to that. Very interesting.
Excellent. Thank you very much for that, Jillian. We've got Haley Evans who's asking, are you able to help someone connect with those that are of the same culture that they are? So some peer connections. For example, if someone came from Hungary and wants to be connected with the Hungarian community, how would you go about that?
We do have connections set up. Even we have like a mentorship program. It's run by one of our staff, and they help with connections into the community, and it could be different organizations. So let's say, for example, if it was a religious community, it could be like a church or a mosque. They could send it to and make different connections and relationships. And even in for example, our youth program, we have a lot of people from different backgrounds. So, for example, if someone notices in our center that there's a youth that maybe speaks Arabic or something like that, we have like a lot of youth where they can connect with and hang out and talk with each other. And there's different departments in our section that will be able to like help with connecting with different people. We have like open houses as well for different communities. So at our folk arts website, I believe, that they can visit. So we have like Syrian open house, there's like Greece like open house, and there's different communities and organizations where they can meet people that are similar to them and connect and hopefully like integrate better. Excellent, thanks. And Haley, if you want to come off mute and add anything, please do, but no pressure. We've got a couple more questions, and again, we've got a little bit of time, so if folks want to add some questions, please do to the chat pod, and we'll keep moving along. So Madison asks, are there limitations to the services that the resources listed in the presentation? So some of the resources listed included Brock Health, Victim Services, etc., that can be provided to newcomers.
So, for example, with career planning, the organization I work for is limited to services we can provide. We're unfortunately not funded to provide financial incentives to employers for clients who are not citizens or PR.
Yeah, even that is like a problem, even with some of our programs at our center. Like some immigration statuses are able to access services while others are not. And what we try to do is that we try to find the right referrals where they can access the help. The good thing about our mental health program, that it didn't matter for us, the immigration status. We were able to help all people regarding their statuses. But I do understand how that is an issue, and a lot of times it can be a limitation. And I think that's sometimes frustrating for the newcomer client as well as us. But I think like it has to be with like funding issues and stuff like that. So I'm not sure how to really go about this solution, but I guess just trying to find other resources in the area or outside the area so the clients get the best services possible.
And maybe some future advocacy efforts if it's affecting multiple organizations and a systemic issue.
Mm-hmm. For sure.
So,
yeah, and collaboration is a big thing as well too. So just talking about like certain needs or barriers or whatnot, and just working together, talking about it and how we can just help best serve not even the newcomer population by itself, but just people in general for mental health. Sometimes there's long wait times and there's like stigma around it, and I think we can all do better just by talking to each other and making sure that everyone understands the issues provided.
That's right, framing that larger conversation as you guys pointed out at the outset of the presentation today, coming up with solutions together. So Mary asks, did you do any work with international students at Niagara College?
Other than we did work with them, it wasn't directly with the mental health program, but we had one of our settlement workers went there every Friday to Niagara College for the one in Welland and the one on Niagara on the Lake to help with settlement and help with like visas and what stuff they would need after they get a job, what's their level of English that they need. But I don't think we directly had mental health, like maybe sometimes we would have presentations there and stuff, like at Brock University. But I also think like at Niagara College and Brock University, they have their own workers and their own mental health providers there as well. So I'm not sure how much we could have impacted there, but we can always collaborate and talk with the post-secondary organizations.
Great, thank you. Haley asks, how do you find interpreters for your agency?
I can do that one, Allie.
Okay, you got it.
Well, as a volunteer coordinator, actually, Haley, we have tons of people who come to us with language skills, looking to engage themselves with the newcomer population. So this is often one of the things that I call on our large database of volunteers for. In addition, if we can't find the language within our staff team, we often look to our volunteers because that provides us with hundreds of more people who may have those language skills. Another resource that we have used before is the 211. I think somebody else had put it in, Teresa maybe had put it there. Sometimes you can actually call in to find an interpreter via the 211 service as well. So this is another resource that we often use on a daily basis in our center. But like Ali said, we do have representation from Mandarin-speaking, Spanish-speaking, and Arabic-speaking staff in our center, which are our most often spoken languages.
Great. So, Jillian, if you'll bear with me here, I'm going to skip down to Teresa's question since
yeah, sorry, I'm trying to jump.
No, it's okay. So I'm just going to read for the folks on the line to benefit from. So Teresa asks, so how are you dealing with language barriers and one-on-one counseling? Volunteer interpreters, is 211 interpretation services limited based on issue when first language counseling is not available?
Ali, maybe you could speak a little bit to that experience. Ali was actually engaged in some of the counseling, but not so much myself.
For the language barriers, for the most part, our center, we did have a lot of language spoken here. So we have I think at our center we have like maybe 30 different languages spoken or something by like staff. We have like Hungarian, French, Arabic, Spanish, Mandarin. So a lot of times we did have services provided where we could translate for them. On the rare occasion that we might not, we would get translators from elsewhere to provide the services. But a lot of times, even at our center, just because we might not speak to them in their first language, because their English levels might be good enough where we can communicate with them in English as well. But obviously, yeah, there are some gaps. Like if it's like a language that's rarely spoken at our center, then it can be very difficult. I remember we were trying to, not a client, but we got a call from another organization to help a client, but it was a rare language that was spoken, and none of us knew how to speak it, and we had to reach out to community members and see if there was. So obviously there are gaps, and it is hard just because there are so many languages in the world, but we try our best to get like the most common languages spoken, and I feel like in our settlement department and in different areas, we have a good amount of speakers that can translate most of the languages that we do have.
Great, thank you. So I'm going to go back up the queue here. Zumu, what would you suggest implementing to facilitate a community space? And I presume this means in contrast to institutional spaces you guys highlighted.
Let me see. I would just say, I don't know, that's a good question. I don't know the answer to that one, but that I will get back to you on that question.
It could be a whole other webinar.
Yeah. Sure.
I mean, Ali, I think I would add, I'm a community advocate as well, obviously working in the nonprofit sector. I would add, I'm newer staff here, but from my experience with the tail end of the mental health project, I would definitely say that the non-traditional way of talking about mental health, not only offering that one-on-one traditional service that we see in most of our conventional mental health services, actually expanding beyond it and having those social support activities, this is very representative of what a community space looks like in terms of supporting our newcomer population and their mental health needs. I definitely think that's a definite first step in implementing that kind of space versus more of a bureaucratic institutional space. And as Ali mentioned in the webinar, I think the entire feel and philosophy of going into a nonprofit organization and receiving these services is much, much different than entering kind of a hospital or an office kind of space. So I think that we are at an advantage that we already exist as a very active community space in the Niagara region. So this is, like Ali said, this is how we actually gained a lot of the momentum for our program. Folks would be here using other services, and they're very comfortable in this family-oriented space. And then we would actually be able to, if they needed, bring them into our mental health program and connect them with some of our counselors and some of our support activities. So kind of that snowball effect that we already are a community space, but I think there's many more lessons to be learned in terms of how to welcome even more people in.
And Jillien and Ali, I think you both mentioned things specific in your project, social supports like trust circles for men and women, love languages, like that funnel being a bit different, as you mentioned, so bringing them into your space and then that, safe space to explore. Absolutely. And then maybe within be referred to other service. It's sort of a nice safe way to move through the supports that you guys have created. So, Julie, we've just got one more minute, folks, and we've got two last questions, and then we'll wrap up. So, Julie asks, do you have the data to differentiate how many newcomers have pre-existing mental health issues versus mental health issues that have resulted as a result of coming to Canada?
We do not have that data, but I would be interested to look back on the files and try to see if I could find something about that, because I never really looked at it that way. And I think it would be interesting to think if, I'm sure maybe some of them had mental health issues, because a lot of them did come from war-torn countries, so they did see losing loved ones and sacrifices that they had to make, traveling and all that stuff. So I do think there were probably some, and then it was probably maybe exasperated by coming to Canada, like not being able to talk to their family, some families still in their home country. But I never really looked at it that way, but I do think that would be something that we could look up and try to see if we can find the data for it.
Yeah, certainly lots of trauma. It's not an easy process. On that note, how did you define mental health? Did you have a working definition with some parameters or things that guided the project?
I think we just did, like, mental health is just the overall well-being. We didn't try to look at it just as, like, psychology or whatnot. We just, like, every individual, like, their mental health is differing from everyone else, and we just try to see ways that we can help them cope with normal stresses. And I guess mental health would include all factors, like the emotional well-being, your social well-being, your psychological well-being, and like how you feel and how you act. And I guess we just try to look at as holistically, where the whole body and the whole self. So I think that's, I don't know if we had like a defined set definition of mental health, but even sometimes we wouldn't even use the term mental health. We would use the term well-being, because the term mental health sometimes has stigma with newcomers, and the association, maybe sometimes they're labeled as crazy back home or mental health. But when you use the term well-being, I think it puts at ease like the newcomers or people that there's stigma with, I think.
Yeah, it creates a safe way, right, for people to self-identify.
Absolutely.
Where they're at and relative in a relative
for sure.
way. Well, thank you so much, guys, for coming today, for allowing Niagara Connects to be your first webinar. You guys did an amazing job. You've pulled together some great work and are doing some obviously very important work. We know mental health is an issue that is salient to our Canadian population, and then, of course, the newcomer population having a whole other host of barriers and challenges to integrate with society. So we really appreciate your time, your effort, your open hearts and minds, and sharing with our community. And we will share with folks that have joined us today the recording. We'll be posting it out to the Niagara Knowledge Exchange. We'll try and pull together some of the other resources that we talked about on the line and make sure we can actively connect folks that highlighted an interest to work with you going forward. Absolutely.
Sounds good. And we're thankful for you guys at Niagara Connects for setting this up. And we're thankful for the audience for sticking around. I know there was some noise in the background, so I do apologize for that. But we are very appreciative of this opportunity, and we're thankful that you guys had us.
Thank you so much. Ali, we invite you all to continue the conversation with us. Right, Ali?
I 100% agree, yeah. We're open. Sorry, I was drinking water at that time, but yeah.
Well, Niagara Connects will hope to facilitate a little bit of that ongoing conversation. And thanks again, everyone, and we look forward to connecting soon. Take care and have a wonderful afternoon.
Thank you.
All right, bye.